So at this year's SOHO meeting, I provided an update on the menin inhibitors for 2024 and gave some details on the array of menin inhibitors that are in clinical development. There currently are 4: revumenib, ziftomenib, lexamenib, and enzomenib, which have been in development and have shown clinical efficacy. So overall, each of the menin inhibitors is showing clear signs of clinical benefit in patients with CR/CRI rates of 20 to 30%, overall duration of responses in the range of 6 to 8 months, and other elements of clinical benefit such as morphological leukemic-free states, as well as transition to transplantation in patients with relapsed and refractory KMT2A-rearranged and NMP1-mutated disease. Now, aside from these 2 subgroups, we still don't know whether the menin inhibitors are going to be effective for other subsets, but in the relapsed refractory setting, these numbers approximate what we saw with the IDH1, IDH2, and FLT3 inhibitors that led to their regulatory approval. As we know, the first menin inhibitor, revumenib, is currently undergoing FDA review with a PDUFA date in December. Now, that did get pushed back from September, not sure why, but the expectation is that the efficacy that we're seeing across the class is going to lead to approval of at least 1 menin inhibitor for treatment of these disease types, probably in the next 6, if not 12 months. Looking forward to that. Combination studies now being performed with conventional intensive chemotherapy 7 and 3 and ven-aza, with early results from the ven-aza menin inhibitor combination showing up to 80 to 100% of patients in the newly diagnosed setting getting some type of benefit. So I think there's more to come, and it's clear to me that the menin inhibitor is going to be the next approved targeted therapies for these subsets of acute leukemia.